Thank you very much for joining this meeting, which is part of the webinar series organized by the Health Data Research UK Scotland. So my name is Catalina Vallejos, and today I have the honor of introducing Robin Flegg, who is going to tell us all about the UK Longitudinal Linkage collaboration, for which she is a co-director. So Robin is currently based at the Asher Institute at the University of Edinburgh, and besides her leadership of UK LLC, she is also a Chief Operations Officer for Generation Scotland, a cohort that I know very well. Prior to her work on GS, she was also the UK Biobank's led for the data linkage program for about 7 years. So Robin has extensive expertise in data linkage, data governance within longitudinal research, and she provides expertise and guidance to many research cohorts throughout the UK. She has particular expertise on the data linkage, in particular with linking UK GP records, as well as linking data across and harmonizing data across the UK nations. So without further ado, I'll leave most of the time to Robin for sharing her slides. Just to note, Serena just put on the chat, we are recording this event, and if you have any questions, we will take them after Robin's talk at the end, okay? So Robin, please share your slides. I'll let you know once we can see this.
Is that working?
Yes, there it is. The little box in the top is disappearing slowly. So just get started whenever you're ready.
All right, well, thank you for that lovely introduction, Catalina. So as Catalina said, I'm Robin Flegg. I'm based at the University of Edinburgh, and I'm here today to tell you about the UK Longitudinal Linkage Collaboration, or UK LLC for short, because it's quite a mouthful, which is the National Trusted Research Environment for Data Linkage in Longitudinal Research. And the UK LLC is led by the University of Edinburgh and the University of Bristol, and in collaboration with many other organizations across the UK. And you can see our trusted research environment is hosted by the University of Swansea's SeRP platform. And we were originally funded as part of the Longitudinal Health and Wellbeing National Course Study in response to the COVID-19 pandemic. So you will see that currently we are only open for COVID research, and that is in part because of the way we were originally funded. We were co-developed as an organization with our partner studies, their principal investigators and data managers, and we are funded by a partnership grant in which all of the studies are partners. So I'm sure many of you are familiar with UK Longitudinal Population Studies, but I thought I'd just start at the very beginning to make sure it's really clear what we're talking about when we talk about longitudinal studies in the UK LLC. So longitudinal population studies are a unique UK scientific tradition and a huge resource that I'm sure many of you have used over the years. Participants are selected by their shared characteristics, and on the right-hand side of my screen, you can see some of the studies that are part of the UK LLC that have these different shared characteristics. So the 1946 birth cohort, which is the first study at the top of the screen, was a group of people who were all born in the same week of 1946, and they've been followed up ever since. Generation Scotland, which I am a part of, is also a family cohort study where we recruit people and families to look at their health and well-being over time with genetics. Born in Bradford is another family study with a birth cohort aspect. Understanding society is why we don't call ourselves a cohort project, because it is not a study of people, but of households. And then we have studies like ELSA and Nicola that look at a particular time in your life, the studies of ages. And Scotland has one of these as well, which has my favorite study acronym, HAGGIS. And finally, the last example on the screen is the Airwave Health Monitoring Study, which looks at an occupation, which is being in the police services. There are many other kinds of studies. There are many that look at particular diseases or conditions, but just wanted to give you a few examples of the kinds of studies that are in UK LLC. Participants in longitudinal studies are followed up and observed repeatedly over time, and that is where the longitudinal comes in. And I just Wednesday had a public contributor say, that's such a terrible word. I never hear it used, but it is accurately descriptive of what these studies do. And finally, and this is hugely important, and something that is at the heart of everything we do in UK LLC, is that the participants in these studies provide data within a consented relationship to the study. And that can never be forgotten and always has to be respected. So the kinds of data longitudinal population studies we collect are vast and varied. There are over 300 studies with over 5 million UK residents, and Our Future Health is aiming to increase this number hugely by aiming to recruit 5 million people across the UK. They have unparalleled depth and diversity of data collection within the studies. They collect survey data, they do assessment visits to people's houses, or people come into clinics, and at these visits they can do all kinds of measures, from taking somebody's weight to doing an MRI scan. They also can collect samples and do all kinds of genomics and different kinds of biological analysis. However, they also get consent to link to data that is standardly collected over time, so that they can do not only active follow-up of their participants, but passive follow-up without any effort on their part. So the most common in medical research studies are health records, but studies that are in the social sciences will also link to things like education data, socioeconomic records. It's very common now to link to geospatial or place-based data about where you live or where you work. And the newest emerging thing is smart data. So collecting data on your phone about how many steps you've taken, what your sleep pattern is, all kinds of other data. All of this can be linked to the study data and provide a unique research resource within each study. And these are just a few examples, because this is an HDR UK Scotland presentation. I've picked a few Scottish studies to highlight recent news stories about them. So the first one on the left is the Viking study that looks at the genomics of people who were born in Orkney, Shetland, the Western Isles. The second one is the Lothian birth cohort study that's been examining people from age 11 to 82 at the time of the article, so now probably 83. And then the Guardian article in the upper right-hand corner is a demonstration of how bringing these studies together can define new risk factors. And this was an international study across 29 countries that happened to include Generation Scotland data. And finally, there's the Decode ME study that looks at ME, and you can see some of their research results, even in the short time they've been running, can show that women may suffer more from ME than men. So what is the UK LLC, and what does it mean for these studies and for researchers in general? So it's a new way of working. It's a national trusted research environment for longitudinal population studies. So that means all of these studies have provisioned data into our trusted research environment, and we become a one-stop shop to apply to access all these data together. We provide record linkage as a service, and I'll go into more detail about where we are linking records already and where we plan to go. And because we're doing it as a centralized resource, that means there are centralized data flows and data security. We're ISO 27001 certified and also have Digital Economy Act accreditation of our trusted research environment. And this makes things simpler for studies. Studies don't have to go through the onerous process of, for example, getting PPAP approval for their linkage in Scotland, or approval from what used to be NHS England, and before that many other names. It's easier for the funders, because the funders were having to fund each study, paying for their data linkage from the different data providers. And it's simpler for data owners. They only have to review one application across all the studies, and they can know that it's one set of information governance, and it's just a much simpler process. And it provides a highly diverse studies all in one place, which means you have an increased number of people brought together, which is statistical power. I'm sure I don't need to tell you all of this, but also it means that more rare exposures and harder to reach people are brought together, which means it's easier to support research in these areas. But it does not undermine participant trust. We have to respect the key study participant assurances. As I said, it's a consented relationship. The study is the trusted data custodian. UK LLC makes no decisions about the release of study data for research projects. These are always decided by the study data access committees themselves. The data is only linked when the study has agreed. So each study has different sets of consents and permissions that they've agreed with their participants. And even within each study, different participants have consented to doing different kinds of linkages. We have our system set up so these permissions can all be indicated to UK LLC, so data isn't linked where it shouldn't be. And also, we respect participant opt-out. So we get quarterly refreshes of these permissions. So if a participant withdraws from a study or decides it no longer wants to be linked, we can respect that, and it's updated every 3 months. We provide a 5-phase governance framework with our TRE and applications and access process. And we have public and participant contributors integrated across the whole of UK LLC in co-design and decision-making. And I'm going to go into just a wee bit more detail here. So we have 3 public representatives on our Strategic Advisory Committee. We have a citizen panel that is reviewing our access process to make sure it's inclusive and measure public acceptability of our data use. Every researcher who applies to access data in UK LLC must present to our data access public review panel, and they review every application for data access with a specific focus on the lay summary being properly lay, their public involvement plans, and whether the research project is in the public good. We have a public advisory group, and you will see their work all over our website. They co-produce our public-facing materials and communications. If you go on our website and see some of our animations, they have been involved in co-producing all of those. We also have a higher level public involvement network that allows people to just give us feedback on specific asks. For example, is our website easy to navigate and clear? And finally, we often will create a project team if we have a specific question about a new data linkage. Then we can recruit across all of these groups to create a project team to examine something, for example, like the acceptability of linking to shopping loyalty card data. So these all are integrated into the work we do, and we even have public contributors come to our all team meetings, and we have an annual Q&A session with the management team and all of our public contributors. So it's really important for transparency and acceptability. So the UK LLC is a globally unique cross-cutting resource. We have over 22 studies and over 300,000 participants in our trusted research environment. We've linked to NHS England and linked to NHS Wales data, and the NHS Scotland linkage has been approved. We're still exploring how to work with Northern Ireland NHS data. We have agreement from the Department for Work and Pensions and HM Customs and Revenue to link to those data sets, and we are working with the Department of Education in England to link to those. We would expect that these linkages will come through over the course of this year. We also hold environmental, neighborhood, and property data. And as you may have noticed from the list of our studies, we hold studies that are funded by ESRC, MRC, the Wellcome Trust. We support social science as well as medical research. And as I said at the beginning, we're powered by the SeRP infrastructure. So I'm going to go into a little more detail about what data we hold, but you can also explore it for yourself, and I'll tell you how in a little bit. So I'm going to start with NHS England, which was our first successful data linkage. And I'm really delighted to announce that we have signed a new data sharing agreement with them this month. So when we originally applied to access data from NHS England, it was restricted for COVID research only. Our new data sharing agreement moves us from COVID only to support research in the public good. And this has been a huge milestone for us. What it does mean is we will be available, the data in UK LLC will be available for general non-COVID research in about 3 months. The studies must inform their participants and update public-facing materials about the new change to UK LLC, and we're aiming to move the studies over in 2 rounds for public good research, one roughly in 3 months, and the other by the end of this year, but hopefully sooner. And what I want to say about our NHS England linkage is that it is actually groundbreaking. So NHS England have delegated approval of access requests to use their data to us, and we have a linked data review panel who does this. But they have also delegated consent review, which they will audit, of course, to us as well. So they're not going to go through all the consent materials in their meetings. We are taking responsibility for that, and that is unprecedented. So these are some of the data sets we are linking to within NHS England. It's not a full and exhaustive list, but it gives you a sense of the range of data that we have. We also have some COVID-only data sets. Now, unfortunately, in England, the primary care data that's available is only available for research into COVID-19. We were hopeful that this would transition into being available for general public good research, but with the dissolution of NHS England, it's really unclear when that change might happen, although everybody is pushing quite hard for it. These are examples of the NHS Scotland data that we will be having available by the end of this year. We have agreement from the Public Benefit and Privacy Panel, but we have to go through a few more negotiations, and then of course the data has to be linked. And Then we also have environmental exposure data, which has been modeled by University of Leicester and St. George's. We have air pollution and noise pollution data, green space and greenness data, and we have the potential to link to a lot of wider exposures, as you can see on the slide. We also have place-based data in UK LLC. We have neighborhood data. We have property data. But what I will say is this data is not universal across all studies. It's only when the correct consents are in place, and it can be linked at different levels. So for example, one study is only allowed to share postcode information and nothing more. So they can only link to a certain level to some of these data, and we have to respect that. So as I said, we respect the study's commitments to their participants. We also, as I said, will be getting HMRC and DWP data, and I thought it would be helpful for you to see which data sets and what kind of data is in them. So you can see we'll be getting employment earnings, tax, pensions, and tax benefits, benefits and incomes, and the kind of data we're looking to get from the Department for Education. Those negotiations are underway, and once those are in place, we will work to see if we can link to Scottish education data as well as Welsh. So I just wanted to give you a sense of the kind of data we can enable by bringing longitudinal population study data together with linked data. So this is an example of a publication where research was done on the prevalence of long COVID during the pandemic. And this illustration shows that if you look in UK LLC and you define long COVID from self-report, only 4.7% of the cases of long COVID are seen in the GP records, and that the kinds of people who receive a GP diagnosis are biased. So the data shows some people are more likely to receive a GP diagnosis than others, middle-aged people, white ethnicity, and living in less deprived areas with certain health conditions. And this is probably completely unsurprising, but the scope of the amount of unreported uncoded long COVID actually shouldn't be a surprise to any of us, because it wasn't even a diagnosis and it had to become one at some point in the pandemic. So this shows, particularly in an emerging dynamic situation like the COVID-19 pandemic, data collected directly from participants shows a fuller picture of what is actually going on in the results of the pandemic than just looking at the coded data. And this is similar to healthcare disruption and avoidable hospitalization. So if you look in Open Safely, which is access to English GP and hospital records, there's no evidence of a link between healthcare disruption and avoidable hospitalization, or reduced patterns of avoidable hospitalization, or narrowing and evidence of narrowing of inequalities. However, if you look at self-reported disruption measures found in the longitudinal studies in UK LLC, they actually show that you were 80% more likely to be admitted to hospital for preventable conditions if you had health care disruption, and 35% of people faced healthcare access disruption during the pandemic. So I just wanted to demonstrate a few of the kind of projects that UK LLC enables to show the true cost of disease. There's also been publications on the impact of furlough, and there's many other things enabled, particularly once we get the administrative DWP and HMRC data added to the UK LLC resource. So when you bring all of these different kinds of data together, it provides a rich resource that enables new research questions to be asked. So you might be thinking, oh, this sounds amazing. How do I access it? I'll take you through that now. So it's one application. You can access data from all of these studies, linked to all of these places, and the data is frequently refreshed. We have one application across all these data sets and a consistent process to process it and review it. We aim to have fast turnaround times from submission to decision. So when you submit your full application, we review it within 2 weeks to get it out to the full review panel, and they have 4 weeks to get back to us. It's always a balancing act between safeguarding and data use constraints with fast access. So I'm going to take you through the process now. Stage one is expression of interest. So we review that to make sure it meets the basic requirements to do research in UK LLC. And I haven't said this before, but only applicants based in the UK can access UK LLC. And as of right now, they have to be COVID-19 related, although we expect that to change in the very near future with these new agreements with NHS England. The project, of course, has to be scientifically sound. We have to hold the kind of data that you need to answer your research question, and the research, of course, has to be in the public good. If all of those conditions are met, you're then taken on to stage 2, full application, where the application is based on the 5-site access model. Researchers accessing data in the UK LLC TRE must be ONS accredited, and each organization that they're based at must have security evidence, and that can be ISO, it can be DSPT, which is the NHS England requirement, but there is another mechanism which we've used with many Scottish universities, which is the System Level Security Policy, or SLSP, another lovely acronym, we have so many. And we can work with organizations who need to get SLSPs to help them get those in place to be able to access data in UK LLC. Once it's past stage 2 and we've done our internal review of the application, it then moves to stage 3. That involves, as I said, it goes out to each study that has you've applied to access, to their data access committee. It goes, as I described, to our data access public review panel. And as I mentioned, we have delegated authority to approve access to NHS England data, and that is done by the Linked Data Review panel, which is made up of people from UK LLC and also members of our partnership studies. And we had one of those meetings this morning, and there was quite a spirited discussion. The expertise that's brought by the various people in the studies, from PIs to data managers to researchers, is immense, and really make sure we have a very rigorous review of these applications. If you're applying to access data that is DWP or HMRC data specifically, and likely Department for Education as well, the ONS has not delegated us approval to review and approve these applications. So once we finish stage 3, and this has never occurred, so we don't know how long this will take, although we expect it to be relatively quick, the ONS Research Accreditation Panel, or RAP, another acronym, will review the application to approve the release of that data. Once all of that's occurred, then everybody's favorite part of the process, the contracts must be signed. Each institution in an application must sign a data access agreement. This is modeled on the standard one HDR UK created to try and make it simpler for organizations to sign these agreements quickly. It's the same across every application, it doesn't change. Each user must sign a data user responsibility agreement. Once those agreements are signed, data provision can happen in 1 week into our trusted research environment. And this is what some of the resources are that we have to assist researchers in using UK LLC. So this is a screenshot of Explore, which is our metadata exploration tool, and also how you can select data sets to be included in your application to access data in UK LLC. So here, for example, on the screen, you can see the EXCEED study, which is from the University of Leicester, which describes exactly details about the study. And then you can also see the data sets they've been provided. Once you've explored there, you might want a bit more data and information, and you can go to our guidebook, which has details around how you might define data and metrics and how the data is collected across all of our linked data sets as well as our study data sets. And you've looked at all of this and you're like, yes, I definitely want to do an application. Then you can go to our lovely application system, which is helpfully named Apply. And the first time you want to access Apply, you need to register. And then once you've registered, you can log in and fill out your expression of interest when it's time, your application, and you can track where your application is in the process by logging into Apply anytime. This is what it looks like when you access the trusted research environment for UK LLC, and you can see some of the programs that are available. We also have key things created within our trusted research environment to make data use easier. We have some core harmonized variables and core derived tables. We also have a code list reference table. So if you want to define a disease condition, we've imported the HDR UK phenotype library into UK LLC using an API. So you can access all those code lists to define your conditions. And finally, we have a monthly user group meeting where you can interact with the UK LLC data team to ask any questions you have. Although if you need help sooner, we have a help desk, of course. We also have bite-sized videos and FAQs to describe how to do things like using GitLab in the UK LLC TRE or requesting files in and out of the UK LLC TRE and many, many more. And finally, we have our GitHub. We, of course, support reproducible research, and all outputs are checked before they're allowed out. And you can see that we require that your code be put in our GitHub so that it can be used to reproduce research if researchers want to define a similar thing like long COVID that you might have used in your research, then the GitHub will have that code available for you. And finally, and I've waited to mention this, but excitingly, UK LLC is free to use. For right now, that is how we are currently funded, and our current funding period runs to 2028, and we are hopeful that we can keep ourselves primarily free to use for the rest of that time and provide our centralized and highly efficient data access to all this wonderful data with public involvement throughout our design and decision making. And in the next 5 years, we hope to expand to include more studies with more participants. We're looking to see if we can build an omics platform because that's a huge ask of our partners. There are many studies that you have a lot of omics data that they want to include in UK LLC. We're working to improve our user experience. We do have many things in place, but there's potentially more harmonization that can be done, more training videos, making it simpler and easier to use UK LLC. We're looking to enhance our data linkages, looking into smart data and other kinds of data linkage that we are hoping to move forward. And finally, we work quite closely with Population Research UK, which will be funding enhanced infrastructure. And we're hoping that we can create a training TRE with synthetic data to help researchers learn how to use the very complex data in UK LLC. And finally, most importantly, we are a partnership with our longitudinal studies, their participants, the infrastructure providers, public contributors, and of course you, the wider data science community. So if you want to sign up for our newsletter, you can scan the QR code, but it's also now on our website. And you can email us if you have any questions, and I am happy to answer any questions. Hopefully I've not spoken too quickly, but thank you very much. I think I will stop sharing.
Thank you so much, Robin. That was a really, really good overview. And we actually have lots of questions for you in the chat, which Stella kindly has answered some of them already. So I will take them in turn of those who came from the top, and I will ask people to unmute themselves. Stella, if you have answered them already, I tried to monitor those that you answered already, but I might have missed some of them. So Desi Slava, do you want to unmute yourself? You had the first question.
Yeah, yes. I think it might have been already answered though. Yeah, I think my question, well, there was a couple of questions, but one of the question was about yeah, so I understood that it's currently accessible to academic research community. Is that correct?
Yes, that's correct. So currently there isn't commercial access. I probably should have made that clear. My apologies. But yes, any UK-based researcher should be eligible to access it, assuming they've had the right training and they have the right research question.
Okay. Yeah, I'm just interested because I work in like a real world data kind of epidemiological stage in commercial settings. So I feel like this would be really, really helpful. The data you have is incredible. So yeah, if at any point that is possible, you know, we're very happy to support.
It definitely is in the plans to make commercial access available. What I will say is not all studies have consent for commercial use.
Yeah.
So like anything else, there will be only a subset of studies that you would be allowed to access as a commercial user. And each study has its own prerequisites about what they might allow. So even if they allow commercial use, it might not be.
Yeah. Okay.
Still. And I guess the other thing is we have to follow what the NHS says, so it can't ever be for purely profit-making purposes.
Yeah, definitely. Thank you. Thank you so much.
Thank you. Justin Young, you had a question. I think that the answer has been answered about the cost. Do you have a remaining question? Justin, are you still here with us? I think so. So we have a question from Alex Knight regarding to the OMOP. database. So are you using the OMOP?
So we are in discussions about OMOP. We recently had a meeting with European studies about OMOP. Some of our studies have applied OMOP. So for example, the Borden Bradford study has already done OMOP on their data, and I know other studies are looking to do it. But it's complex, and it's also designed for health data, and we hold other kinds of data. So I think we're looking to see, I think UK Biobank might be OMOPing their data, and we might follow what they decide to do rather than trying to invent it ourselves. But it's on our watch list, but we haven't done it yet.
Great, thank you.
Thank you. Will Catron, do you have a question as well? Thanks.
Yeah, you mentioned at the beginning that some of the studies have MRI data, imaging data, and I wondered, we analyzed the data from UK Biobank using deep learning. I wondered, how many studies have that data? And if you wanted to apply deep learning using GPUs, would that be done through the TRE, or would you have an exemption like in UK Biobank where we can download the data?
So currently we don't hold any imaging data, and we don't currently have a record of which studies have it and which studies don't, although we could easily ask our studies. So that's one of the things we do have regular meetings. So if there's an interest in a particular research topic, we can take that to what we call our Vanguard group. We don't currently have the money to create a platform to allow image analysis. That wasn't in our core funding for our second round of funding for our 5-year funding. But it is on the list. But also the other thing is we could potentially put your question out, and then you could at least get a summary of who has imaging data. It would be nice to have a platform, but as I say, it's expensive, and we don't.
Yeah, but it may be too early stage. If I have a grant deadline next month,
Yes, I mean, we could
too early to propose this.
We could help you put it out to the studies, so you could maybe quickly find which studies had it.
Okay.
The other place I'd recommend maybe looking, although I know it's not entirely accurate, is the Atlas of Longitudinal Data Sets, which recently was released, and it does have an imaging question, but I also know it's not entirely accurate because it has Generation Scotland not having imaging data, and I know it does. So I think, but that's a place to at least get a sense of who has imaging data.
Great, thank you.
Okay, and Griffin, you had a question also. I think that question about fees has been covered, but do you still have it?
Sorry, my other question was just the same one that Will's was about GPUs. That's been answered to you. Thank you.
Thank you. Rest of questions have been answered. Thank you, Stella. You have been great at answering many of the questions. So any other remaining questions, please raise your hand if I have missed them from the chat. Griffin?
Yeah, sorry, actually one did just this come to me. So I'm kind of aware that certain TREs, say Open Safely or CPRD Safe, there's been some, I guess, teething issues with getting some of the analysis software to work properly, like particularly sort of custom Python libraries. So, you know, if you want to do some kind of very basic odds ratio type thing, that's fine. But if you wanted to do a slightly more complicated analysis, that has proved difficult in some of those other TREs. Is that something that UK LLC is like aware of? Is it something they've kind of solved? What's the kind of status on, I guess, say there's some R library that you want to use that you have to install into the LLC?
So I think you have to request installation. But what I will say is because it's hosted by SeRP, which hosts the SaIL databank and is a very mature TRE in comparison to, say, Open Safely, I think they are familiar with these challenges. And so I think particularly for R, I wouldn't expect it to be an issue at all. And I know most of our infrastructure is developed on Python, so I would be surprised if Python wasn't allowed. But it's something I don't know in full. I don't think we've had particular complaints from our current users about it at the minute.
Okay, that's great. Thank you very much.
Okay. Actually, related to that, I'll check. If you wanted to add some libraries to be installed, do you have an idea of what are the timelines for approval?
So I think probably our team would have to check them as a data in. Currently, and in part, I think this is because we've been COVID only, we don't have huge backlogs. So I would say generally it would be pretty quick at the minute. As we get used more heavily, we are a very small team. So I would be unable to predict it, but I would expect right now it would be relatively quick.
Okay, thank you. There have been a couple of questions in the chat about people working in research cohorts that would like to be added to LLC. So maybe you can
Sure. When we were funded to add 3 additional cohorts. 2 of them were specified. So one was UK Reach and one was Caerphilly, because they had unique challenges. We have 1 slot left, but currently we aren't funded to support more cohorts or LPS than we have. So studies have come to us, and if they're applying for funding, we have a cost model that allows them to fund our work to not only onboard them, but as you can see from managing the applications, there's additional work with each additional study. We are looking to see whether the funders would be open to some sort of mass onboarding of studies, because we've had over 35 studies come to us with interest. There would probably, if we did it that way, there would have to be a prioritization exercise done. But we really are keen to find out about what studies would be interested in joining, and we always will write a letter of support and give you costing if you're going for funding to help with that. It's not ideal. We would love to just be a service, but I can tell you our applications team is basically Stella, for example, with a little bit of support. So that's the thing. We're not funded to the level where we could support lots and lots of studies at the minute.
Okay, thank you. Any other questions? Please raise your hand. Not a minute. No. Okay, so Serena has just put additional information on the chat about our next webinar, which will be next week. Please sign in if you can and would like to join. And there are a few extra questions. There is one extra question about the cost model for onboarding and managing process. So I think Estella has put some contact details in the chat that you can contact to get more information. And I have final question, Robin. In terms of, a lot of studies sometimes are looking for replication. So in my case, for example, we are looking some analysis in UK Biobank and how this will be replicated in Generation Scotland. So do you have any plans in the future to kind of communicate with other trusted research environments for kind of federated learning or things like that go beyond the cohorts that you have currently?
Yeah, so we explicitly put in our application for funding that we would like to become a replication platform for UK Biobank. Obviously, for some research, this is impossible until we have a omics platform. But for example, you could replicate some disease definitions and outcomes, because our population is far more varied than UK Biobanks, because they recruited from a certain age range and all of the limitations we know of their data. So we felt, yes, that is explicitly one of the reasons we were set up, was to be able to provide a simple way to access a more representative replication platform for research done, say, in UK Biobank or Our Future Health, when that becomes possible. Absolutely.
Okay, thank you very much. So unless we have any other questions, we can close for today. And thanks again, Robin. Wonderful presentation, and Stella for monitoring the chat and addressing all of those questions. And of course, always to Serena and Rachel, who are the force behind all of these webinars and most of the SeRP UK Scotland activity. So thanks everyone, and hope to see you next week.